I am Dr. VK Chauhan, homeopathic physician. Revise with me Abrotanum, a important homeopathic remedy. General aspect: it was proved by Dr. Cushing, Dr. Deventer, Dr. Gatschel, used especially for marasmus in children, rheumatic, gouty, and exudative affections. Constitutional characteristics: somatic predilectation, children with face old, paled, wrinkled. Great emaciation, skin becomes flabby and hangs in loose folds. Abdomen bloated, marked emaciation, especially of legs. Head is weak, cannot hold it up. Psychic preponderance. Temperamental disposition is violent, inhuman, would like to do something cruel. Mind in general, child is ill natured, irritable, cross, and despondent. Affinity. Tissue affinity is serous membrane, general nutrition, GIT, joint components. Thermal affinity, chili. Lateral affinity, ambilateral. Diathesis, tubercular peritonitis, ascites, hydrothorax, marasmus, and rheumatism of children. Miasmatic markers, acute diseases like mumps points to psoriatic flare. Gouty inflammatory problems points to psychotic trait. Tubercular inflammation points to syphilitic trait. Impression: Abrotanum is mixed soro-psychosyphilitic miasmatic medicine. Causation: suppression of secretion, diarrhea, dysentery, suppressed rheumatism, and great weakness after influenza. Characteristics: alternating complaints, alternate constipation and diarrhea, alternate rheumatism and dysentery, alternate rheumatism with hemorrhoids. Ravenous hunger, losing flesh while eating well, serious exudations like peritonitis, pleural, and joint affections like synovitis. Characteristics: oozing of blood from umbilicus of newborn, metastasis of mumps to testis, pancreas, breast. Food and drinks: desire bread and milk, aversion to sweets. General modality: aggravation, cold air, wet, checked secretions, fog and night. Amelioration is loose motions and posology. Doses 3rd to 13th or higher potency. Repetition can be repeated till response is noted. Single dose of higher potency. Duration of action: we have no definite information. Clinical: chilblains, gout, hemorrhoids, hectic fever, furunculosis, hydrocele, marasmus, pleurisy, peritoneal effusion, rheumatism, juvenile rheumatoid arthritis, juvenile delinquency. Marasmus can be remembered by mnemonic Marasmus only. M stands for marasmus, A stands for alternating complaints, R stands for rheumatic complaints, A stands for affections from suppressed secretions, M stands for metastasis mumps, U stands for umbilical bleed, and S stands for serous effusion. Clinical: marasmus, a constitutional specific remedy for marasmus. Child has an enormous appetite, constantly crying for food, pain in the stomach and abdomen, bloating and large stools. Food passes undigested, skin flabby, hangs loose. Marasmus usually seen in infants below the age of 1, and kwashiorkor is seen in 1 to 5 years of age. Both of them, they have protein calorie malnutrition. Clinical: chilblains. Chilblains after exposure to cold, skin becomes purplish, burning and itching sensation in the affected areas becomes more intense in warm room. Gout, pain in shoulders, arms, wrist, ankles, pricking and coldness in fingers and feet, legs generally emaciated, joint stiff and lame, painful contraction of limbs. Hemorrhoids, frequent urging for stool, bloody stool, worse rheumatic pains abate. Children's, they are having hydrocele. Testis is an intra-abdominal structure which is descended down to the scrotum. While coming down, it can bring about the peritoneal sac and when it remains open, you will find different stages of hydrocele will be noticed: non-communicating hydrocele, communicating hydrocele, and hydrocele of the cord. These conditions are self-limiting. Exudative pleurisy. Whenever there is inflammatory exudate, we find that it is seen after operations for the chest, operation for hydrothorax. A pressing sensation remains. Respiratory, raw feeling, impeded respiration. Tubercular peritonitis. Abdomen has got ascites. Stomach feels as if swimming in water. Feet cold, gawning hunger and winning, indigestion with vomiting of large quantities of offensive fluid, abdomen hard lump in the abdomen, distended, alternate diarrhea and constipation. Juvenile rheumatoid arthritis. 5 or more joints in the first 6 months of disease, asymmetrical joint involvement, large joint of knees, wrist, elbow and ankles are often affected. Morning stiffness, joint pain, intermittent low-grade fever is there. Juvenile delinquency. Delinquency is not merely juvenile crime, it includes all deviations from normal youthful behavior. Children who are habitually disobedient, who desert home, mix with immoral people, those with behavioral problems, indulging in antisocial practices. Child is very irritable, cross and violent, want to do something cruel, no capacity for thinking, anxious and ill-natured. Angioma. Angioma of face. Angioma is a benign tumor of blood vessels. Thank you for watching.